Good evening and welcome to the Nikki and Rule podcast experience. I'm Reuel Sample. Nikki is on vacation today. She has sent me numerous videos of her time down in warm places as we struggle with 40-degree weather and rain. So, Nikki, wherever you are, I hope you are enjoying yourself. But the good news is that we're going to have a great podcast without you. So it's nice to have on board with us truly a wonderful person. I've been looking forward to talking with her for the last 2 months, ever since I found out about her organization. As we were talking before the podcast, Katrina and I started talking about her ministries and the things that she's doing at Good Shepherd, and she just launched into what she's doing. She is so incredibly passionate about what she is doing. So I cannot wait for everyone to get to know her. I want to welcome on board Katrina Knight, the executive director of Good Shepherd. Good evening, Katrina, and welcome to the podcast.
Thanks so much. I'm excited to be here.
I am too. As I said, I've been looking forward to this for quite a while, ever since since before the beginning of the year, and I'm so glad that you could take time because you folks are incredibly busy down there at the Katrina Center, the Good Shepherd Center. Tell us about the Good Shepherd Center. What is it?
What is Good Shepherd? So we are over 40 years old. We are just a local organization, actually a regional organization that serves this region of North Carolina. Most of the folks we serve hail from New Hanover County, Brunswick County, or Pender County, unless they are veterans, in which case they might come to us from Onslow County. But we have an array of services all aimed at addressing either hunger or homelessness. So on the hunger side of things, we began as a soup kitchen back in 1983. We still have that soup kitchen. It's open to the community. We have a breakfast and lunch Monday through Friday that is trying to really kind of be a stopgap. We have a lot of hungry seniors, a lot of sort of your working low income folks who rely on us to kind of fill in the gaps of what they're able to afford in terms of their pantry at home. And so not just substantial meals, but also healthy meals as well, because particularly our seniors and our folks with disabilities, they often come to us already with some compromised health, and we want to do what we can to kind of shore them up nutrition wise, not just in terms of getting them through that next hour of being hungry. So we have some related programs that salvage food from around the community, that create food boxes for seniors and other folks with special needs who we have moved out of homelessness to housing, but who may have a hard time getting to the grocery store or again affording adequate amounts of food. Everything else we do is aimed at addressing homelessness. So for more than a couple of decades, we've had a day shelter that is really meant to be a safe haven for unsheltered folks. You know,
Hmm.
sort of the folks you picture who might be still sleeping on the streets or in their cars. You know, they might be reluctant to come in for the night, especially if they have a severe and persistent mental illness. You know, coming in amongst a bunch of strangers is a very scary thing for anyone, but especially for some of those folks. And so during the daytime hours, it's nice for them to have a place to come in, like today, out of the elements, a place to
Yes.
take a shower, to use the phone, to receive assistance applying for a job or reestablishing their identification because maybe they've lost their photo ID or their social security card or what have you. So again, it's kind of a safe place to first kind of come and regroup. We provide case management, including for that group to help them make a plan for returning to housing again. There's a clothing closet attached. There's also a medical clinic that is a partnership with Cape Fear Clinic, and it's not a full-fledged medical home, but we have a full-time nurse staffing it, as well as a physician assistant, um, uh, providing anything from chronic condition diagnosis and maintenance, an awful lot of that. We have a lot of asthma, diabetes, hypertension amongst our group. but also a lot of folks who, might have a serious condition requiring an eye surgery or some sort of specialist care. And they really look to our clinic staff to help kind of smooth the way and refer them for some of these advanced procedures that they need. So we
So
serve that
this
role
is
too.
this is all happening at your day
Hmm.
clinic. I want to go
Yes,
back.
yes.
I want to get back. I want to get deeper into that. But before I lose the thought process, as you were talking about
Sure.
your soup kitchen, for lack of better words, but you serve more
Hmm.
than soup, of course. You used the word food reclamation. Now, I
Hmm.
have a feeling I know what that is, but I want to make
Hmm.
sure that I know what that is.
Sure.
What is
Yes,
food reclamation?
kind of glossed over that. So, in part to make our soup kitchen happen, because we may serve 130,000 hot meals in a year. That's a lot of food we need to bring in to make that possible, especially when we really want to be including fresh produce and lean meats and things that will just not just fill people up, but again, really kind of fuel their nutrition. That's a lot of food that we need to be bringing in some way, either purchasing it or through donation. And so we've always had an attached program called Second Helpings, and we have a whole core of volunteers just for that program, where 7 mornings a week, these folks are going out to grocery stores, sometimes restaurants, and even catering companies sometimes, and they're literally rescuing food or
Hmm.
collecting food that these partners have set aside for us. When I first visited Good Shepherd and was told about Second Helpings, I just assumed we meant food that was on its way out the door, to be thrown out, like apples with big spots on them or unusable canned goods or what have you. And what's amazing is uh, it's uh, it's as much as 500 tons of food a year, that you could argue might otherwise have been thrown away, but for the most part, it is very quality, usable produce, meat, dairy, bread products, things that we rely on to make those more than 100,000 hot meals possible. What's also was interesting to me when I first got to know Good Shepherd is, for sure, some of it is making those soup kitchen meals possible, but the majority of it we actually give away to other community partners, like Mother Hubbard's Cupboard, which is solely a pantry. They're not doing served meals, but seniors and other,
Hmm.
low income folks are going to them each week looking for pantry items to take home, to be able to make meals from. Nourish NC, a much younger organization, but one that fills a real need in terms of feeding families. If we can help these groups by collecting this food and then funneling a lot of it to them, we're making our mission happen, even if we didn't meet that senior or that hungry family or what have you. So, of the 500 tons of food that we are rescuing, collecting, reclaiming, um, we are redirecting the majority of it to these other folks to make sure that not just through Good Shepherd, but through these partners, it really is getting in the hands and honestly in the stomachs of the adults and children who need it the most.
That's 500 tons of reclaimed food just here in New Hanover County a year.
That's right. Hmm.
That is absolutely amazing. You also threw out another number, 138,000 meals a year. That comes out to roughly, what, 300 to 400 meals a day that you're serving?
It varies by the day. Probably our record in a day with some fluctuation, might be 500 on a very busy day. We find that seniors, for example, if they're living on a fixed income, things might be leaner for them toward the end of the month than they are at the beginning of the month. And
Sure, that makes
so
sense.
it's
Yeah.
not unusual, for example, a couple weeks ago, late January, if it was, at the end of January, we might see more of our elderly neighbors coming in for lunch, to have a substantial meal and to help them through to the next day. We never want any of our neighbors to be skipping meals, but we do know that that is a reality for some of our elderly folks, for some parents where there isn't enough to go around. We see mothers skipping dinner. If those folks can come in with us and get a really substantial meal, even if it's just for lunch during the day, it's going to help them through, what is a difficult time, but help them through to the next day.
Now, as also at your day shelter, in addition to the food, they are, as you were saying earlier, they're getting medical care. They're getting that's called a document care. Is that they're getting updated driver's licenses or IDs.
Mhm.
Um, how many you partner with a medical clinic? Which medical
Mhm.
clinic are you partnering with?
For many years, we partnered with the New Hanover County Health Department,
Hmm.
and they were just amazing. I mean, the best relationship with the health department I've ever had. More recently, we are partnering with Cape Fear Clinic, and they are a bona fide standalone nonprofit, of their own. But they are the ones who, so they now supervise our nurse, so that we fundraise for her, but she has medical supervision, under their, licensing and insurance and so on. But they're also providing either a physician assistant or a nurse practitioner multiple times a week, so that we actually have two medical professionals to see our folks. And they provide daytime hours, but also once or twice a week they will be here in the evening as well. Because contrary to what a lot of folks think, many of the people who come to us for shelter and stay with us, they have jobs. So
Hmm.
they get up in the morning just like you or I might, get their kids ready for school, and then they leave for their work. And we might not see them again until 5 p.m., 6 p.m. Some of them have jobs where they don't get back home to Good Shepherd until 9 p.m.
Hmm.
And so it's helpful. We've had to make an adjustment in all of our services, because we can't be an 8 to 5 or 9 to 5 kind of operation when so many people, when they're available to meet with their case manager or they're available to see a nurse, is in those evening or weekend hours. So we have to adjust to the needs of the people who have come to us for services.
Now that's a transition into the next service that you provide. You've got food services, you've got day shelter, and then you've got night shelter. How many people can are you sheltering families? Are you
Mhm.
sheltering individuals? What's your setup like?
So interestingly, and this was decided before I got here in 2004, Good Shepherd is a shelter that is a little untraditional, non-traditional, in that we shelter single men in two dorms, single ladies in a separate dorm, and families with children. And the families have private rooms where each family has its own room to return to each night with their children. And so we're a little unusual nationally. A lot of groups will pick a target population or a subpopulation, and they will create a shelter that is just for single gentlemen
Hmm.
or just for women and children, let's say. And so from our first night of operation, we have always endeavored to serve every demographic that might need us. And the upside of that is, if tomorrow a single father with children presents for shelter and needs us, we will be able to accommodate them, rather than say, oh, we're only set up for ladies or ladies with children.
Interesting.
And so about 100 is our max. And I'm sorry to say, for many months now, we have been back at 100. We had many years ago brought that nightly census down by being more housing focused, and that felt like great progress. We might meet 50 new faces in a month, but it wasn't 50 new faces on top of a group of people who maybe were chronically homeless and had sort of gotten stuck here, where we hadn't figured out how to help them up and out. So it's a little disheartening to be at or back at 100. And again, that's single women, single men, and families with children. We do also at the same time have a waiting list for every one of those populations, and that is new territory for us. Honestly, during this COVID era. Um, it hasn't been unusual in the past to sometimes have a wait list for the single gentleman, let's say. But to have a wait list for every population, including families with children who might be sleeping in their car, waiting to come in, or in some other situation that, as the federal government says, is not meant for human habitation. That's new territory, and so all the more reason we put pressure on ourselves to expedite families' moves out of shelter and back to housing again, not only for their well-being, but also to create space for that next family that is waiting to come in and who we want to bring into a safer situation than where they are currently.
That's got to be the toughest thing in the world to have to turn away a family that's
Hmm.
coming to you for need. Does that happen? Well, you're saying it's happening more
Hmm.
and more. How
Right.
how does your staff handle that?
Ooh, that's a tough one. Obviously we care for everyone in crisis, but veterans have a special place in our hearts, and others, families with children, the little children. We've had parents come to us straight from the hospital with a newborn. I mean,
Hmm.
we've had
Hmm.
in the last year or two, we've had a baby born in the shelter. So, the staff have been through it. Um, you know, I will say I'm really proud of our team because, we never presume we have everything figured out. And in fact, I think we presume we don't have everything figured out. And even as we're making mistakes, trying to improve our strategies and how we respond to people's needs, we're always brainstorming what could we do more and better. And
Hmm.
so, for example, I don't know if I could tell you that 10 years ago, we had the ability sometimes to rehouse a family straight out of their car. But that happens now sometimes
That's
where a
amazing.
space didn't open up in the shelter, but we were able to go ahead and connect them with one of our case managers, who we call case manager slash housing specialist. And that person began working with them and strategizing with them. Okay, well, what income is at play? What are some options in terms of affordable units? Can we facilitate uh, meeting a landlord, filling out an application? Maybe we can step in with first and last month's rent or application fees to kind of expedite things, or to get that landlord's attention and encourage them to rent to our family instead of, someone else. And so I would say it really kind of took off early in COVID out of desperation when we were having to try to decompress our shelter operation. A congregate shelter is not set up for 6 foot distancing. So we temporarily stood up an extra shelter at a motel. But in that era, the first really painful year of COVID, uh, we we got pretty good at never moving somebody out of their car until boom, we're ready to move them into their apartment. And so, that would have been kind of unthinkable 15 years ago. In part because there weren't always the private or government supports that we need to make that happen. In 2025, it's a lot more expensive to rehouse a family today than it was 10 or 15 years ago. I mean, I can remember back when $500 often made the difference. We can't rehouse somebody with $500
Not in New
anymore in this
Hanover County.
state. No, and increasingly not in Brunswick County. Every county is beginning to catch up with us in terms of the lack of affordability, which is really an unfortunate thing. And again, we shelter and rehouse people out of Brunswick County and other,
Hmm.
neighboring counties as well. We're not just about Wilmington. Um, so that's definitely part of it. We could talk more about this, but I feel like we've already taken on a lot, and I worry about. I always want to make sure we can do a good job with what we've already committed to. At the same time, to their credit, our board of directors are routinely often asking, what more should we be doing? What more could we be doing? And at the height of the pandemic in 2020, they lost no steam saying, what more could we be doing? Even when I thought I was just trying to keep people alive here in this building. So one of the things we plan to do in the next 2 years is expand our main campus across the street from where we are on Martin Street, just south of downtown Wilmington. And as part of um, a multi-use building, if you will, one really key component of it will be a new, bigger, more supportive family shelter. So while
Nice.
I can't lean on it today, I can picture the day in the not too distant future when instead of 4 families, we might be able to shelter 6 or even 8 families at a time. So every week, every month, every year, we will be able to serve more families and, more quickly move them out of the less than healthy situations that they find themselves in, before they reach out to us.
I want to bring up some stats here. Let's see if I can't get it on the screen here. Um, this is from the Housing Build North Carolina website, and it's talking about that over the last 15
Mm-hmm.
years, North Carolina has outstripped national trends in its increase of unsheltered people. While that has gone down a little bit, it is now coming back up. And it's using terms like sheltered homelessness and unsheltered homelessness. But we're seeing that trend come back up at the end of 2024. Is that what we're seeing here in Wilmington? Are we typical of what's going on uh, across the state of North Carolina? And also uh, help me define that sheltered and that unsheltered, because you talked about it earlier.
Sure, sure. So, for example, all around the country and here in our Tri-County community, our continuum of care or our region, we engage in a point in time count every January. And it's, as a methodology, it has its weaknesses, but it's meant to be kind of a snapshot, on a given night, how many unduplicated people could be identified as being homeless. So in January 2024, for example, right about 600 people were counted or identified. And here in our community, about roughly half were sheltered and half were unsheltered. So sheltered meaning everyone who was in Good Shepherd that night, let's say it was 100 people, were part of the 300 number sheltered. So they're homeless, they are currently receiving services and they're safe with us that night. But technically they're not in housing yet. And so they count as homeless still, right?
Mhm.
So so Good Shepherd, for example, accounted for roughly a third of the sheltered number. Folks who are have a roof over their head, but it's not permanent housing yet. They're not back in an apartment. The other approximately 300 were folks who were identified as still living on the street, in the woods, in encampments, in their cars. And that number has increased a good bit in recent years, and particularly during the pandemic era. We weren't seeing these numbers before 2000. I'm sorry, before 2020.
Mhm.
As a community, I can't tell you how many times, uh, you know, uh, a TV reporter wanting to do a lead in about Good Shepherd makes a comment about how homelessness is always on the increase. We kind of assume that that's true, but it's not true. It hasn't been true nationally or for North Carolina or for our community. There was a good length of time where by being more housing focused, we had actually brought the trend line downward, contrary to, what one might presume. COVID has really reversed some of our progress, which is frustrating and incredibly frustrating. And there, I think, are a lot of reasons for that. sometimes when you're still in the midst of something, it can be hard to kind of pick apart the drivers and the reasons for it. Um, but it is a new situation, I would say, that we're back to a number like 600 on a given night, and where so many of that 600 are unsheltered. Some of
It's
those
interesting.
folks might be people who are seeking out or accessing our day shelter. They would still be considered unsheltered because they're not coming in for the night, if that makes
It's
sense.
interesting. It's interesting. You're talking about COVID in the present tense, where
Hmm.
a lot of the country has moved on from COVID, but you're saying that you are still wrestling with the effects of COVID even now.
Hmm. Yeah, and I don't pretend to completely understand it still. We still have COVID go through this building periodically, both on the
Hmm.
volunteer. Sometimes the volunteers bring it in, or the staff appear to bring it in, or it goes through our shelter guests. We try really hard to keep everyone safe, but it's a lot of people in one building, again, in close proximity with each other. We probably have 500 regular volunteers. That's just a lot of people from the community. So just as if you have a friend or a family member who works at the hospital, and they'll tell you, oh, there's a lot of RSV right now, there's a lot of flu right now, there's a lot of COVID right now. Whatever the hospital is experiencing, about a week later, we usually see the same thing where we are. Um, you know, I say COVID in terms of the era and the 2020 and beyond. Some of some of what I think we are experiencing the repercussions of are some of the housing related things that have happened since the advent of the pandemic, that I for sure, I of all people, had no foresight with, did not see coming. And an example would be, I would have thought our economy, would crash. We might have a recession. I didn't foresee all the buying up of properties and flipping them, and our rents just in New Hanover County, our rents have gone up 50% in 5 years.
50% in 5 years. That's just
Right,
renting. We're not even talking about the
right.
buying a
And
house.
and I think we all know home ownership, right?
Yeah.
A starter home is not $200,000 anymore. But yeah, just in the renter community, and I can remember, gosh, it was either 2020 or 2021. We received a call from a father of a disabled child, and he was not homeless. He was not ever going to be homeless. He was not ever going to come to our soup kitchen. He had nothing to do with Good Shepherd other than he didn't know who else to call, right? Which I feel good about that in a way. But his message was, my landlord has sold the apartment building I live in. uh my rent is going up $500 a month, like immediately. And what he said to us was, I could stretch $100,
Right.
maybe $200, but I don't know where another 500 every month comes from just to stay in the same apartment and keep my disabled child in his same school. And he was looking to me and to us for answers, and that felt terrible because I did not know
And
what to. He's probably a great worker. He might even have what he perceives to be a pretty decent salaried job, but he's not going to get a $500 a month increase, just to pass it off to his new landlord. And so that was, I don't know if it was a canary in a coal mine, but that was one of the first things I remember happening that was like, wow, this is new and different. That people are calling saying, I've never needed help before. I'm not going to be one of your clients. I'm at a loss what I'm supposed to do. And so since that time, multiple of our different local or regional housing coalitions or housing committees have either commissioned studies or leveraged data, from a state group that has helped us see that, hey, it's that father times like thousands.
Mm.
People's earnings don't increase 50% in 5 years for the most part, especially our service workers, especially our public servants, like our firefighters, our police officers. You know, when you hear the city talk about how many vacancies they have and how difficult a time they're having filling those, housing costs are a huge driver of that. Folks are doing the math and they're going to less expensive communities. We're losing workers to less expensive communities. So that the cost of housing, you could talk cost of living, but cost of housing as a proportion of that is really outsized. And as a community, we're struggling to figure out how do we ensure that there is a range of housing available for people along the whole spectrum of what people earn here.
So, how do we go about affordable housing here in New Hanover, where land has become more and
Mhm.
more of a premium? You can't jump a curb and not
Mhm.
hit new development someplace.
Sure.
There are houses put in around our neighborhood that started out at $300,000.
Hmm.
Well, $300,000 will get you a cement pad.
Hmm.
Now and you've got really nice apartments going up, but those are a lot of money. What do
Sure.
we what do we do about affordable housing here in New Hanover and Wilmington specifically?
Hmm. Well, there are a lot of strategies at play. I do also think our city, our county, and our elected officials are increasingly aware that this isn't just a heart issue. It's also a very real economic issue. Those of
Hmm.
us who are employers, when the people we employ cannot afford to live in the community that they work, that's a problem for us individually, but it begins to be a problem, for all of us when Novant's workers have to live 2 counties away, when our public servants are far away. Um, so, it's a lot of things. The city of Wilmington, New Hanover County, for example, they have both made investments in both housing production and bringing units online that maybe target a more modest like 60% area median income, which people might think are the poorest of the poor, but teachers would qualify for that. A lot of our salaried workers who are salaried workers but not earning $100,000 a year,
Hmm.
would qualify for some of these, more affordable apartments. We're fortunate to have some developers, some who have a long record here in our community, or some who have just kind of come into this space in the last year or two, who are willing to do the really tough work of leveraging tax credits and figuring out the complicated packaging to create, for example, a Starway development on Carolina Beach Road that will be not quite 300 units. That really moves the needle. You've got, I, I'm kind of fascinated by something that New Hanover County tried or has tried in recent years, which is um, kind of you could call it kind of a housing subsidy program, but it's sometimes targeting teachers, uh, not your poorest of the poor, but folks who we rely on in this community, and we want them to be able to afford housing. So stepping in maybe with $200 or $300 a month to bridge the gap between what that individual can afford and what they need in order to have reliable housing. New Hanover County has had some good success with that. And I can't say it as articulately as he did, but a couple of years ago, I heard Michael Lee say, um, I think it was his idea originally in some brainstorming, and he said something to the effect that, ordinarily I wouldn't be behind something like that, but in an unusual market or an out of whack market calls for some unusual or out of whack or out of the norm strategies. So he said it much better than I'm saying it. But I thought that was really interesting. And it also reminds me, one of the housing reports that was put out maybe a year ago, there was a quote from a young teacher who was moving here, had been hired by one of our schools, was very excited to teach in New Hanover County until she went looking for housing. And her quote was something like, I feel like I feel pretty good about my salary. I feel like for where I'm at in my career, I have a pretty decent salary, but I go to apartment complex after apartment complex, and they want me to show 3 times the rent as my income, or they tell me I'm
Wow.
not qualified. And so I'm getting rejected over and over and over again, and I don't know where I'm going to live. That's
Wow.
not what we want. Teachers, I think we all agree, teachers already have it's so tough, right? In so many ways. We don't need on top of that for them to have this stress of not knowing where they're going to live. Can they live anywhere within reasonable distance of the school where they're teaching? We don't want to make their lives any harder, and we don't want to give them reasons to leave New Hanover County or to decide they're not coming to New Hanover County. So that really resonated with me because, when I was starting out, first of all, I never had to come up with first and last month's rent and security deposit just to get a landlord to talk to me. That never happened. Uh, of course, rents were so much cheaper back then too. Um, but I also never had to prove that I had 3 times the income. And it kind of makes sense. The landlord wants this to be very low risk. They've got lots of takers. They have lots of options of who they could rent to. Um, and yet that does begin to feel a little impossible for just like regular folks
Hmm.
who we rely on. And I'm part of some housing groups where we are asked to focus on or talk about workforce housing, and there's a certain definition for that. Sometimes it's 60 to 120% of your area median income, or 80 to 120%. And I can play that and I can participate in that, but I also at every turn try to find an opportunity to say, yeah, but you know what? This is Wilmington. This is New Hanover County. This is Brunswick County. Workers here make $10 an hour. They make $12 an hour. It doesn't start at $40,000 a year or what have you. Just today alone, probably everyone listening to us relied on somebody at some store, at some coffee shop, getting groceries, who makes a very modest hourly amount. And we don't want those people to decide that they can't afford to live here anymore because we need them. And we're going to
Yeah,
continue to rely on. And they're not going to travel from 2 counties away to make 12 or $15 an hour because at some point that's going to feel untenable to them.
I have lived in places where after storms or hurricanes or whatever, the workforce housing is blown over, and
Mhm.
then developers come in and put in these really expensive places that only the rich and wealthy can rent. And there's
Mhm.
nothing wrong with being
Sure.
rich and wealthy, but then what do you do? How do you get the service folks in? How do you get the folks who
Mhm.
take care of those houses in? How do you
Right.
and it the whole thing collapses. When you took over this job, you're the executive director, and your primary purpose is to make Good Shepherd Center run. But it also sounds like you're an advocate outside of Good Shepherds for these things that are affecting. Did you ever think that you're going to be an advocate for folks outside your community?
Yes.
Oh,
Yeah. Well, I would say 2 things. So I my interview with God love them. The at the time Good Shepherd board was very unusual. Obviously, they were trying to feel out my abilities, my, from their view, was I a fit? But I was asking them really tough questions too. Because, if their vision at the time they were about to break ground on the night shelter. And, I wanted to know what is that about? Is it just that you see an unmet need for about 100 beds a night, or is there more? Is it just about keeping people alive overnight and that's going to be the outcome? Or is it more? And to their credit, they did not find me too off-putting, and they basically said, you know what? We don't even know what we don't know about this. If you're saying there's a better way, we would be open to learning, and we would support you in learning and trying to do more. Because my feeling was, if this is just to keep 100 adults and children alive overnight, you don't need me for that, right? Like, I mean, we don't have to like roll our sleeves up and act like this is really tough if that's all we're doing. But if what we want to do is try to create an experience where we return shelter to being as short an experience as possible, and I don't have it figured out, but learn from others, learn from what's working elsewhere, and really try to expedite the return of homeless veterans back to housing, homeless seniors back to housing. How do we get these people up and out so that coming to a shelter isn't coming here to live? That we're really getting people back to being our healthy neighbors again and not staying here. And so they were like, you know what, we're in. We don't know either, but we're in, and we will support you at every turn. And they really have. I mean, at every turn, every iteration of our board has been all in on this. And I wouldn't have come I wouldn't have come here to do this in 2004 if they didn't seem really genuine about supporting me in advocacy. Because I if I disappeared tomorrow, I would hope that their full expectation of the new person would be, you get out in the community and you don't just talk up Good Shepherd, you talk about why so many folks are in housing crisis and what our responsibility is to do about that. And my feeling is there's no greater prevention of homelessness than having adequate units of affordable housing at every level of income, but
Hmm.
also whether you're Good Shepherd or somebody else, how are we to move that mother and her children out of this shelter experience if we don't have anywhere to move her to? How do we
Well,
help the veterans at our Sergeant Eugene Ashley Center leave that behind and not live there forever and have the dignity of their own home again if we don't have any apartments less than $1,500? So it's education and advocacy. And I will say my mom is 92. She sweet lady, but she'll tell it like it is, also real southern. And at different moments in my life when she felt like giving me a zinger in front of some people, she would announce, Katrina's greatest talent and skill is being offended on other people's behalf. And she would say it in this not very funny, not very kind way. It was meant as a response to, I was probably acting out in some way. But maybe there's something to that, and maybe I've tried to, if you're going to have a big character flaw, try to use it for good instead of bad.
it's
So
it's
maybe there's something to that as well, where I'll be honest, I feel like you know we don't all have to have something fancy or huge or what have you, but modest housing, do I wish that for every person in our community? Absolutely.
Mhm.
And I kind of mourn the days where we had more options for people who were just starting out, were a young couple, a young GI. We've lost a lot of the lower income or modest options from our community, and so it stands to reason that more people are going to struggle who you or I would agree we would love to see them in a place of their own, even if it's just a cute little apartment to
Yeah.
come home to every evening.
We definitely need to keep your plucky 92-year-old mother away from my plucky 93-year-old father,
Uh-oh.
because I,
Okay.
I, I, I don't think either one of us could handle that. And one of the things that you mentioned earlier, and you didn't put it quite this way, but I want to kind of reword what you
Hmm.
said, is that you are meeting the needs of people, but you're also steering them away from needing you. And I like that. I like that philosophy, which brings us to this other terminology that I read when you wrote an article for the Wilmington Business Journal, and you used a terminology called PSH. What
Hmm.
is PSH in the mission of the Good Shepherd Center?
So permanent supportive housing is something that we began learning about several years ago. I'll be honest, our shtick is just to assume we don't have everything figured out and we need to engage in some continual learning. And
Hmm.
so we're big fans of looking at the National Alliance to End Homelessness, for example, because they're really good about putting out real digestible, user-friendly information about research and real evidence-based outcomes, just like you might have in medicine or the health community, but around homelessness and interventions that seem to be working better or not, um, to move people more quickly out of crisis and to help them stay in housing. And so um, several years ago, um, both at conferences and on their website, just reading, we began to learn about this kind of housing intervention or model, a best practice model called permanent supportive housing or PSH. And it's really just a label or a complicated way of describing the marriage of an affordable apartment with fairly intensive on-site supportive services. So it's not just an affordable apartment, which many, many thousands of people need in our community. It's not just services like transportation to the VA medical clinic if you need it, or to a different doctor's appointment or what have you. It's the two combined, inextricably combined in one program. And so for us, what that looks like, and we're gonna sound a little crazy, but to us, it's meant to be used with your hardest to serve folks, your hardest to house folks. So, that person who fits the maybe the mental picture people have of who is homeless, but who actually represents maybe only 10 or 20% of that overall population. So, it wouldn't be unusual for us to, in one of our PSH communities, like Lakeside Reserve, where we have 40 units, wouldn't be unusual for us to move someone who has been in the woods the last 8 years straight into his apartment, or someone who has lived in her car in one of our parks for 3 or 4 years straight into her apartment. It's targeted to folks who have been chronically homeless, so very long time homeless, and or cycling through, ER, shelter,
Mm.
jail, maybe ER, shelter, ER, streets. Folks who tend to have pretty significant mental health issues where they are not able to weigh their options or make choices with the same brain chemistry that you or I have. Folks with very significant medical issues, often a combination, and sometimes including seniors, veterans. But again, in our case, 100% of our residents being chronically homeless and having a really significant disability, typically that contributed to their loss of housing.
Hmm.
These are folks who were housed and it fell apart. And when you get into the detail of how it fell apart, their lack of understanding the lease, their inability to understand expectations or communication with the landlord, or their repeated hospitalizations and inability to pay their rent on time or take care of that while we're dealing with their health issues. It was often the contributing factor to their losing that previous housing to begin with. And so, not surprisingly, these are the folks who have the hardest time. If left to their own devices, they're not able to figure it out. And so, maybe they've been in our shelter for way longer than we would like. Maybe they're living on the street or again in the woods or their car. But the people we're choosing, these are not the hundreds of other folks that we are rehousing in a year. We have a rehousing program for everyone else where we're helping them look for affordable housing. We're helping them figure out where's first month's rent and security deposit going to come from, helping them view apartments and fill out applications. We're doing that with hundreds of others a year. This is for that little crowd. Again, fitting the stereotype, but they're that little crowd who, without a really intensive kind of housing or special housing intervention, they're going to stay in the woods. They're going to keep overusing the ER. They're going to be on the street. And again, lots of reliance on public services. And so there's good evidence that it's no more expensive to actually house those folks, keep them out of the ER, keep them out of shelter, keep them out of jail, by providing a kind of housing that has a bit of a higher threshold for some, unusual behavior.
Mm-hmm.
Your resident might not understand the first couple of nights that just because they're excited and they want to visit with their neighbor down the hall, that you don't go knocking on their door at 11 o'clock, that your neighbor's probably asleep at 11 o'clock,
See,
so
that's why the
let's
neighbor
learn.
gets mad at me.
Yeah, yeah. So, let's learn, oh, it's okay to be excited and it's okay to want to meet
Yeah.
your neighbors, but let's talk about what people typically expect in terms of what's okay, what's appropriate neighborly behavior. You want to go see how they're doing, you knock on their door at 2 p.m. or 4 p.m., or you wait for an opening from them to engage that way. It's understanding a lease, it's understanding or relearning. We pay for our rent before we pay for other things, needs before wants. Learning how to go to the grocery store and pick groceries out and cook for one person. For some of our folks, those are all kind of relearning sorts of things. But one of the great parts of why it was compelling to us learning from other communities and then doing it ourselves, not only like I always think my son once broke his collarbone, so we had to go to the ER. When your child's hurt, you don't want your child behind 5 people who did not need to be in the ER. You want your kid seen. So, selfishly, we want to keep people out of the ER who don't need to be there, also for their own well-being, right?
Yeah.
What's so interesting about permanent supportive housing is it doesn't cure people's medical issues. It doesn't cure people's mental health issues, but almost immediately you see some improvement. Sometimes just by virtue of, well, they know where all their medications are because they're right there on the kitchen counter where they left them yesterday. There's no confusion about where their medications are. So they're
Mm-hmm.
more likely to take them. They're more likely to take them correctly. We've had people who were supposed to have had a colonoscopy 10 years previous, and for various reasons and being homeless, that wasn't happening. But with our support, we can help get them back on track with a doctor, make that appointment. You can't take a bus to your colonoscopy, so one of us will go with and be that person to sit with and wait and get them back to their apartment safely again so
What
that
this
they
pho-
can be taken
what the,
off.
Yeah, I'm sorry. What this philosophy seems to almost force you to realize is that the reasons for homelessness for your clients are as varied as the people that you are serving. And so you just can't simply rubber stamp each one, feed them, house them, send them on their way, feed them, house them, send them on their way, is that each person has their own specific needs. And again, getting them out of the need of needing you requires an
Mm-hmm.
individual approach to your clients, which I think is amazing.
Sure.
I don't want to let you go without telling people how they can help you, because you are completely reliant on people's support of you, whether it's through the food reclamation programs that you have. You have your 21st annual landfall
Mhm.
golf tournament coming up. What is that, and how can people help you
That
through
that's
golf?
our biggest fundraiser of the year. It is at the Country Club of Landfall. It's actually we always have it on a Monday. It's May 19th this year. We're still looking for sponsors for that. And there are lots of ways to contribute. So there are sponsorships at all different levels. But even for folks who don't have a lot to give, we even have T-hole sponsors that are more modest, where there's a little sign with your name or your company name on one of the T-holes, so that all the golfers see it, as they go by over the course of the day. We always need volunteers. We would be hard pressed to be open any day of the year without our volunteers. People's financial support keeps us operating, and it goes wherever the hole is, whether that's on the food services side or the shelter side, or rehousing families, for example. And then again, you brought up advocacy earlier. Folks talking at the dinner table about the need for housing at all income levels. The fact that, it might seem scary when someone's proposing quote unquote affordable housing, or more modest housing down the street from our home or our child's school. And it's okay to have a moment of, oh, I'm not sure about this, but more and more we need to be thinking and talking with each other about, if we want to have a really vibrant Cape Fear community, housing is really going to be at the heart of that. It already is at the
Yeah.
heart of it. And so if we want the children at our child's school to be well, if we want their teachers to be well, if we want the workers that we all rely on to be well and ready to come to work and do their job, they need to have a reliable roof over their head that is, if not 30% of their income, a lot closer to 30% of their income, than it might be today. And so that's an important investment in our shared quality of life.
Katrina Knight, the executive director of the Good Shepherd Center here in Wilmington, North Carolina. The website is goodshepherdwilmington.org, and you can go there. Please go to their website. It's amazing everything that you're doing. It's amazing the campuses. It's amazing the training. It's amazing everything that you are doing to help out folks here in Wilmington. We're going to have you on again, because we're just scratching the surface of the I'm sure that you and Nikki will have a lot to talk about when she gets back from whatever vacation she's on. So, Katrina, thank you so very much.
Thank you. This has really been a pleasure.
I'm going to put you in the green room, and we'll talk soon.
Great. Thank you.
So that's it, ladies and gentlemen. What a great conversation with Katrina. If you get a chance, again, please check out their website, goodshepherdwilmington.org. It's goodshepherdwilmington.org. They are doing quite literally the Lord's work as they help our brothers and sisters who are homeless for one reason or another. One of the big things is we have talked about on this podcast, as well as other podcasts, is the cost of housing here in New Hanover and Wilmington continues to rise. And I don't know if you caught it. She's dealing with folks who are hearing from landlords that their rent is going up $500. Well, I don't care how much money you're making. $500 a month is a lot of money, no matter who you are. These are conversations for the long term that each one of us have to have with our churches, with our elected leaders, with developers in the area, and folks like the Good Shepherd Center are leading that discussion. If you can, make sure that if you can, make sure that to check out their website, check out the golf tournament that's coming up. It's their 21st annual. If you can't do the golf tournament, consider volunteering, whether it's serving in their kitchens, washing dishes, or helping out at the center. they can always use people. Well, thank you very much for joining us. Nikki Baskin will be back with us next week. She'll follow up with her trivia question about New Hanover and the surrounding counties, and she'll probably regale us all with her trips to places unknown. But until then, I'm Reuel Sample. This has been the Nikki and Reuel podcast experience. Wishing you all of the best. Thank you for listening.